All right, let's get started. I don't know if you can hear my birds chirping in the background. Hello, everyone. My name is Jessie Tate. I am a part of the Rethink Travel Marketing team. Thank you so much for being with us today. I am so excited to hand everything over to Suzanne Kerba, who's going to be talking about how COVID-19 prevention and safety measures present opportunities for branding, marketing, and doing the right thing for yourself and your clients. You guys, what a year last year was, and still continuing into 2021. I particularly am excited about this session. I know I don't want any of our prevention measures and actions to fade away. So I think Suzanne has a really important topic today for the future of travel and the future just of our daily lives anyhow. So Suzanne, I'm gonna give it over to you, and you can go ahead and share your screen. And just one last thing, you guys, Suzanne is an excellent resource. So please type through your questions, comments, chat, anything. I'm in the back end here manning those questions. And we do have Suzanne sticking around for some questions at the end. So please type those through. But without further ado, Suzanne, over to you.
Thank you very much for that kind introduction. Let me share my screen now. Can everyone see that okay? Jessie, can you confirm, please?
Yes, you are perfect. That is
okay,
excellent.
Great. Thank you so much. Welcome everyone to On the Road again as we get ready to move back into our sort of what we call almost getting back to normal and moving forward. So it's a particularly important time for the travel industry, I know, and I'm very honored that the Rethink Virtual Travel Trade Show invited me to participate in the event. I participated in November also, and had a lot of great conversations and interesting questions about how public health risk communication can really support the travel industry as we move forward through this interesting time in life. A bit about me, I work on risk communication projects with WHO and other agencies, both international civil service agencies, universities, and worked with CDC and lived in Atlanta for a long time. And I work for different companies around the globe. And so I want you to look at this and say, wow, Sam's worked for some interesting people. And I want you to also know that last year in November, when I spoke to this group, I was wrong about so many things. And I was wrong about COVID-19 vaccine research. Were we going to be able to get the research in place and actually get it up to speed and make it so that it was effective and people actually trusted the compressed timeline that clinical trials were undertaken and that kind of thing? I was wrong about the capacity of vaccine development. Would we be able to, once the science was in place, actually be able to develop the vaccine, develop the processes, develop how we were going to be manufacturing it? And did we even have the capacity to manufacture this volume of COVID-19 vaccine that literally every country in the world needs? I also was wrong about our ability to deploy vaccines into different places. I've been working in the Philippines for the past 4 months, which has more than 7,000 islands, and at least half of those are populated, and every single person needs to get a vaccination who's in these priority groups. And finally, I was wrong about a lack of clarity about vaccine effectiveness. Is the vaccine going to be effective? Are we going to have the data to produce it, to prove that we're in a good place? Are we going to be able to manage the effectiveness with these new variants? I mean, these are conversations that are still ongoing, but I'm happy to report that I was wrong about every single one of those things that's on this slide. And I'm celebrating alongside with my Tour de France guy who sang, yay, I was happy to be wrong this year. So what I do in my day-to-day life is risk communication. And risk communication is the real-time exchange of information, advice, and opinions between experts or officials and people who face a threat or hazard to their survival, health, and or economic or social well-being. In actual fact, every single one of us on Earth is a risk communicator. When you tell a child not to put his hand on the stove, you are exercising risk communication. When you tell a client, you give a client guidance about the rules of your facility or of your place or of your processes, you are giving them, you're conducting risk communication. And risk communication is a two-way conversation. It's a conversation that says, okay, here is the situation. And then the return question is, how do you feel about this? How can we help you get there? So risk communication is not just issuing an order and then washing your hands of it and walking away. It's more about developing the conversation, developing buy-in, and having people understand and accept the information that you're providing to them. So here's an example of risk communication today from the CDC travel website, which is, do not travel unless you are fully vaccinated against COVID-19. This is only recently an example of risk communication that could actually be delivered, right? I mean, so many recently, you haven't been able to fly at all. And before then you weren't able to fly. And before then there weren't vaccinations. So we're in a place right now, and I've been traveling with some of my work into places that don't allow you to travel, whether or not you're vaccinated or not. And it's important to reinforce, all of us who work in the travel industry, it's important to reinforce the value of vaccination, but also at the same time, the value of continuing prevention measures. Everyone has fatigue associated with it, associated with carrying on wearing a mask, carrying on staying apart from people that you love, from visiting places that you love, from seeing people who you want to see. So we all are experiencing this level of fatigue, and you in the travel industry have a unique role to sort of help people come back into this fold and come back into this world that they love, but come back safely. And a lot of people have a different view about what constitutes a risk. So I was talking earlier with Jesse about how when you get on an airplane, sometimes I oftentimes bring antibacterial wipes and wipe everything down, and just because that's how I am. But my husband thinks I'm nuts. He thinks that I'm way too compulsive about it. And maybe it's because of the work that I do. But the long and the short of it is, we see risk in a different way. But we know from research that people tend to be less concerned about risks that they feel like they can control, that are voluntary, that they're choosing to take. I'm choosing to get on an airplane. And they're more concerned about things that are involuntary, right? Something's being controlled by someone else, or something's unfamiliar, or something's very, very, very focused and perhaps fatal. People perceive those risks in very different ways, but the line between the less concerned and the more concerned is not always clear. And so for people who are in the leadership roles that you have in the travel industry, part of that is identifying among your clients and guests where they are on that spectrum of risk perception. Where do they see themselves in relation to the COVID-19 outbreak? Where do they see you as their host or as their provider? Where do they see you as perceiving risk? Can they trust you to know that you're perceiving risk as seriously as they are? This is a conversation that needs to be carried on, regardless of the fact that vaccines are out now. So when we think about perceptions of risk, whenever anyone saw this is from several months ago, of course, but these coronavirus case maps and these showing of clusters, it's hard not to look at that and see risk, even if you don't know what those bubbles mean, because it looks intense, right? That's a lot of bubbles, it's a lot together. You know, these are case counts of a disease that we know to be deadly and fatal. And so people see this, and it's easy for them to see a big risk, but it's also easy for them to move into crisis mode. So crisis communication looks different than risk communication. The risk communication is when you're telling the child to keep your hand off the stove. The crisis communication is after the hand has already touched the stove. So the risk communication is much better to practice, because it's actually the prevention measure. And when people are in crisis mode, we've seen this, I mean, time and time again over the past year. When people are in crisis mode, they typically have difficulty hearing, like actually understanding what's being said to them, processing the information that they're receiving, and actually remembering it. And there's been so much information that's coming out about COVID, about the vaccination process, about priority groups, about the variants now and about the expiry dates of the vaccine. And this is just a truckload of information. And WHO calls this overload of information the infodemic, an epidemic of information. Not all of it wrong, not all of it right, but just a lot to process, and particularly a lot to process in a fear mind, in a fear state of mind. And so as you communicate with colleagues, clients, guests, keep this in mind that we're all having a low baseline of stress based on the events that have taken place over the past year. So we're already partially into this mode of processing things in a different way than perhaps we did 18 months ago. So keep this in mind and also apply these guiding principles for risk communication. First and foremost, and I'll come back to this repeatedly, is creating and maintaining trust. This is and showing your clients, colleagues, guests that you care, that you perceive that there's a risk, that they can trust you with their health and safety in your venue, project, in the environment that they interact with you with. Acknowledge and communicate even in uncertainty. Acknowledge honestly. Right now, for example, we're seeing people who have, sometimes adverse events after vaccination. We can't pretend that some people won't have reactions to the vaccine. That's not true. But we can acknowledge that the risk of getting a reaction to the vaccine is very, very small when you consider the sheer volume of people who've been vaccinated. But it's also much worse than what could happen to you if you contract the disease itself. So being transparent and fast and first with all your communication regarding anything, but particularly regarding a situation like we have right now with COVID, if there's a rumor that starts to spread and you become aware of it, your role is to be first with the accurate information. Your role is to respond first, because as we all know with social media, what comes out of the gate first tends to be what people grab first. And so if it's accurate information, or you're able to respond with accurate information, you're in a place to sort of set the narrative for the continuing conversation. And being proactive in your public communication, whether that's your marketing and your advertising, being proactive about your reliability, your trustworthiness as an entity, as an individual, that speaks to people, because we are in this sort of quasi mode of a bit of stress that we've had and an uncertain situation. And in uncertainty, we tend to relate to each other as people in a more profound and authentic way than we do in sort of just business as usual. Involve and engage those people who are affected by whatever event is taking place. For example, right now we're in areas where there are a lot of infected people with COVID-19. We engage those people. What can we do? We know, for example, in the early, actually last February, not this past one, but a year ago, I was in Nigeria before COVID became a big thing in the West, but already people in Nigeria were taking it very, very seriously. And when I flew into the airport, they flew from Paris into the airport, and in Abuja, they were already screening, they were already questioning, they were already taking temperatures. And I came back to Paris a week later and no one asked me a thing about COVID. A week after that, I flew to DC, Dulles Airport, no one asked me a thing. And then flew back to Paris and no one asked me a thing coming back to Paris either. So almost 30 days had passed from when I flew into Nigeria, where they asked me all these questions, and when I flew back to Paris, where they asked me nothing. So in Nigeria, they were involving people, and they were so far ahead of what was going on in the West because of their experience with Ebola, but also because they have perfected a lot of these surveillance techniques. But more than that, they took this seriously. They took COVID seriously. They weren't like so many countries in the West that said, oh, it's a fancy flu, or oh, it's nothing serious. People who took this seriously have, generally speaking, moved to the forefront in terms of their ability to manage this outbreak. And that's saying a lot when you factor in we do not have vaccine equity. Those of us who live in places where we have high percentages of vaccinated populations, that's great, and I'm happy for us, and that's wonderful, but too many people are being left behind. So I will bang on this drum either, but anyway, back to what this means for you as travel. Using integrated approaches in terms of communicating with people about risk and about other things, that you can't expect them to just hear you one time. I mean, you know this from marketing touch points. How many touch points does a person have to hear the same message from to actually integrate it and internalize the message that you want to send? So we'll coast back to what a difference this year has made. Last year, we were talking about prevention measures. In November, when I was at this same trade show again, we were still talking about prevention measures, wearing a mask, avoiding crowded places and settings. Now, it's a whole new world talking about the vaccines. And what do you say about them? What are the key messages? They're safe and effective. Millions, now billions, I think, of people who've been around the world have been safely vaccinated. And they're undergoing some of the most intense scrutiny and safety monitoring of any vaccine in history. The only one that may even come close is maybe the polio vaccine, but it's certainly not as nothing has been monitored like this. And you see even 1 or 2 cases in small episodes, and people are on top of it, which is proving that the system is working. But at the same time, the prevention measures that we were pushing in 2020 have to be part of the narrative of 2021. So for your guests and clients, encouraging prevention measures is going to be key in terms of keeping you and your clients safe. Maintaining these prevention measures is not easy. It is fatiguing for everyone. And so some people are trying like dynamic ways of trying to encourage people to keep up prevention measures. In one of the places where I was working in the Philippines, the Department of Health had set up sort of selfie stands where when you went to get vaccinated, you could have a selfie stand that had the signage behind you that said you were vaccinated, and they had a blouse that girls could wear, and it was very, very popular among the Instagram influencers. But I'd like to share with you now this one of the other things that we started doing in WHO in the Philippines to encourage people to keep up prevention measures was to think about them in a new way, and to think about actually interacting with them in a very personal way. So we started a series just about these prevention measures to talk about why do you practice these prevention measures. And you'll see it's very compelling, and really has gained a lot of traction on social media. And we had a lot of other agencies and organizations throughout the Western Pacific do the exact same thing. So we have sort of a challenge going on.
I wear a mask because I want to protect myself and my family.
I wear a mask to protect myself and my passenger.
I wear a mask because I want to keep my friends and family safe and healthy.
Nagsusot ako ng mask para mapangalagaan natin ang isa't isa.
I'm fully vaccinated. I wear a mask to protect the people around me who are not vaccinated yet.
I wear a mask because I want to stop the spread of COVID-19 in my community.
Wearing a mask is keeping the doctors, nurses, and essential workers safe.
Thanks for that. These were just colleagues from the office who agreed to participate in this video series. And the next one was about washing hands. And there were some other ones that were done by CDC, did a similar series, and a bunch of other agencies did. But you can see from the standpoint of communication and engagement with clients, partners, and colleagues, this kind of thing suddenly adds a different dimension to wearing a mask. It ceases to be only this onerous and annoying activity. Now it's empowering. Here's why I'm doing this important thing. Here's why I'm taking this important step. And another one in the series is I got vaccinated because, and I'm getting vaccinated because. And for the people who I got vaccinated because, a lot of it was looking in the past and saying, because I want to see my grandchildren again. I want to travel with my family again. I want to go to this place to hug this loved one that we haven't been able to do. And so the travel community is in a unique place because so much of coming together with people involves travel, and whether it's coming together as a family, coming together as friends, coming together in a new place to discover and explore. it's an important role that you have. And it's important also to consider that it's not all fun and games. It's also a real opportunity for you to participate in public health, global health, and ultimately bringing an end to the spread of COVID-19. So in vaccines, the theme for World Immunization Week a few weeks ago was vaccines bring us closer. And so from the travel context, when I was thinking about that, I was like, it's really true, because vaccines, along with everything else that we're doing, will enable us to get closer to the people that we want to be with, will enable us to travel, and will enable us to stop and slow the spread of COVID-19. And this is great. So I thought this was a very, very interesting story about how in certain areas where access is difficult and where education and community engagement is challenging, people are being really creative. And here in Samburu National Reserve, the tourists from Kenya, tourists pretty much quit coming. And so these camel riders, who typically are transporting people to traditional healers, they then picked up the role of serving as community engagement leadership for vaccine advocacy. So they went out trying to build eagerness for vaccination among people who either weren't necessarily reached by traditional means of communication, who didn't necessarily have the health literacy to be able to comprehend exactly what was going on, and who probably heard a lot of hearsay or heard a lot of thoughts from people who weren't necessarily knowledgeable themselves. So this kind of access and enabling people to get the message out and through these unorthodox means, there's a role for travel and tourism in this industry too, in this situation. And we see here from Samburu how these camel riders are helping that push. So a lot of agencies and providers have had to sort of think outside the box to keep themselves occupied during a time where essentially COVID-19 shut everything down. So there've been a lot of different risk communication challenges during COVID-19. And I'm not going to read them all to you, but we know that some overarching themes that still continue, only now we could even say these challenges continue through the vaccine process. So not only are the inconsistent messages about the disease itself, but they're inconsistent messages about the vaccination itself, about the safety of vaccination, about the effectiveness of vaccination, about how long does immunity last from vaccination. So we can see there's all these challenges. And as we saw from the previous slide, we've got people that are difficult to reach physically and vulnerable populations that may be far away. How do we communicate with them? If you're practicing your business in a place that's remote, maybe you're doing some interesting, your work takes you into places, or you serve groups who like to do adventure travel and things like that. You know the risk communication challenges that you face just on an everyday basis. You know, reaching people can be complicated. Any level of communication can be complicated. So these complications are amplified during a crisis time like what we're facing right now. And do not think that we're out of the woods yet. As many of us are being vaccinated, many countries are being vaccinated, many more countries are not being vaccinated. And it's a cliche, but it's true. None of us are safe until all of us is safe. Just like seasonal flu, virus will keep evolving. And the fewer people who are vaccinated, the more opportunities for variants to develop. And so we can only consider ourselves a little bit safe and push for vaccine equity around the world. That's what's going to make this come to an end. In terms of talking about theory, I'm not going to bore you too long, but I think it's useful to think about how people perceive information that they receive. Right? They might say about COVID, am I really at risk of this? I'm not in not in a high risk group. Is it really that bad? In a way, I saw someone who had COVID and then got well. Maybe it's not as bad as they say. And if I get vaccinated, is it going to be really going to protect me? And what's the downside? Well, if I think about vaccination, what is the downside? The downside is maybe I'll have a side effect, or maybe it won't feel good. And I mean, many of us, when we talk about adverse events associated with immunization, any of us who had a sore arm after vaccination, you were experiencing an adverse event. It's a word that covers the spectrum from a sore arm or a headache to a much more serious event. So people hear adverse event and they immediately think the most difficult thing. So people also need a cue to action. What's it going to take to get me to move, to get me to do this thing? And sometimes that's a vision of someone else suffering, a vision of someone else suddenly doing well, someone else not getting sick. And then finally, can I really do this? Can I really get vaccinated? Can I really work up the courage to do that? And in all communications, risk communication theory and constructs, we talk about the importance of self-efficacy, the importance of giving people things to do. This is one reason why we still have to keep repeating the idea of talking about prevention measures, because these give people things to do. And people don't like to feel as though they're out of control of their environment. They don't feel like their circumstances are beyond anything that they can do. And even then, a small task is useful just from a psychological standpoint. So this is the health belief model applied to COVID-19. I zoomed through it just a little bit, but we could also add the word vaccine at the bottom and walk through this again, perceived severity of getting vaccinated. If I get vaccinated, am I reducing my chances? And a lot of these things are spread by word of mouth. A lot of these conversations are had within families, and those of us who work in public health and global health do what we can to deliver information as effectively as we can. We pay a lot of attention, collect a lot of data, perform a lot of surveys with on the ground and at national levels. And so we try to apply these kinds of theories to reaching people with this information and recognizing how their behavior is impacted by these perceptions, how the health belief model can drive the messages that we create, the conversations that we have, and ultimately, hopefully drive us to the point where people are accepting and understanding of accurate information and willing to confidently take action on it. We've seen a lot since COVID began about rumors, and we all know from just personal life, not even COVID-19, how dangerous and damaging rumors can be. And fundamentally, rumors fall into these three categories. That rumors are about what people wish, right? I've heard there's a cure. Well, you wish there's a cure, you hope there's a cure. And fears that reflect the fears of the community, and hostility rumors. So those of you who work in communities that are very tightly knit and that communication is tight around them, and you've heard rumors, you probably know that you probably have just surmised or come to the conclusion that this is pretty much the main three groups that rumors are going to fall into. And we have to also, though, walk back a step and say, what is a rumor exactly? And a rumor is unverified information that's transmitted from one person to another. It's not always false, and it's not necessarily good or bad. A rumor may be, I heard there's going to be beautiful weather tomorrow. It's a rumor. It's not a bad rumor. I hope it's beautiful weather tomorrow. And in actual fact, rumors can be useful in understanding the needs and concerns of communities, but they can also be useful for you in understanding the needs and concerns of your clients, partners, or guests. And the cat on the left, we had that rumor about that ivermectin, which is actually an anti-parasite that's used for veterinary services. So if you have a dog that takes heartworm medication, that dog is receiving ivermectin, there's a great chance. So this is a big global health joke about the cat needing the ivermectin more than you, because the rumor about ivermectin actually being effective against COVID has been proven to be false. So the question then is to remember, most rumors have a thread of truth, or there's something to be learned from them. So why do people share that information? Why do people share rumors? Oftentimes it's to explain a situation or event that they don't understand themselves, but they need to have that concrete information. And so they create it themselves. And to define themselves as being in the know, right? To be the person who's knowledgeable and aware, and to in that sense be able to seem important. And also to feel connected to the issues that are impacting people. I mean, nothing's impacting anyone anymore right now than COVID-19. And so people are going to be sharing rumors about that because they want to appear to be in the know, and they want to be connected to this issue that's impacting everyone. And a lot of people use information as social currency. You've got a little bit of, you've got some gravitas if you've got the information, if you're known as the person who has the information. Sometimes things are just useful or entertaining. We see a lot of stuff on social media that's funny, but that's not right, and but it's still there. And then other times rumors are, of course, to mislead or deceive, and oftentimes politically or economically motivated. We've seen in a lot of places where there's been a lot of economic motivation for people to advance the idea that there is a COVID-19 cure or therapy, and to sell tonics or powders or other sorts of traditional healing concoctions to advance that idea, but not always in a way that is openly hostile to public health, but many times it is. So how do you respond to a rumor? What if there's a rumor that your company, someone in your facility, in your company has COVID-19, or someone was exposed to COVID-19 and didn't report that they had been exposed to someone, that someone didn't manage the quarantine the way that they were supposed to? This rumors may or may not be true, but the point is that you still need to know how to respond to them. You still need to respond to these rumors that may have potential health consequences, which is super important, but they also have reputational consequences. And so knowing how to respond to rumors and applying the tenets of public health. Okay, we know this. Why do people share? How do I respond to the rumors? Well, it's not enough to just say, well, that's not true. It's important to, if you can, to target the source. What's the source of the rumor? Who's the first person who said that? And then from that point, either educate the source of the rumor, because remember, it's not always the spread of the rumor is not always done in a malevolent way. The spread of the rumor, it may just be someone has the incorrect information, and if you're able to provide the correct information, problem solved. Give people prompt and accurate information, and finally, show empathy. A lot of times, people listen to rumors and believe them, only to have us come forward and say, "I can't believe you believe that. You know, this is an idiotic thing that you believe, and you are not an intelligent person to believe this." So do not do that. Do not do that. It's the same with anti-vaccination people, people who are opposed to vaccination. You know, it's okay to ask. And I feel like by showing empathy to people and saying, you know, it's understandable for you to care about the health of your child and to want to have all your questions answered about vaccination. It's absolutely correct and proper, and it's important that you do it. And it's important for me as a public health person to be able to respond to you in a way that's empathetic, that reflects my respect for you as a person, and that also steers you in the right direction for accurate information when you're ready to accept it. So I would say, I can see why you might believe this. I can see why it is true that older people are at higher risk of death, but younger people are not out of the woods. Younger people are also at risk. I think we've seen the numbers starting to spread now in the extension of the age groups of people getting vaccinated for COVID. We know that younger people are at risk, but in the early days of this, we didn't know. And so rumors about that were just that, they were rumors. So responding to rumors when they impact both the health issues of your company and your clients and guests, and that also have a possible impact on your reputational management, knowing how to deal with these rumors and respond to them accurately is super, super important. So finally, in community and client engagement, helping people, go back to the risk communication earlier slide about involving people in understanding the risks they face. So it's not enough to just say you're living on the edge of this volcano and you need to move. People have to understand, why is it dangerous to live there? If they've been living there their family's been there for 1,000 years, they don't perceive that as a risk. Now and then the volcano may go, but it's part of the risks that they find acceptable and that they're willing to deal with. So we have to be respectful of, again, back to that spectrum of risks where people find themselves to be comfortable on that spectrum, and include people in developing these response practices that are appropriate and acceptable to them. So the person living on the edge of the volcano might find relocating inappropriate for a variety of different reasons. So the response practice has to be acceptable to them. So we have to come to a different conclusion. We have the same conversation in public health regarding the prevention measures to maintain physical distancing of at least 1 meter or 2 meters, depending on where you were. We had clients and colleagues of mine in Nigeria saying, we can't even think about that. And then as things came down the road, people said, isolate the person in your family who has COVID-19. Well, someone living in a multi-generational household in a small place, they said, we can't even think about isolating a sick person. So then the conversation becomes, what is appropriate and what is acceptable? If you're in an area where you can't avoid being 2 meters away from someone because of where you work in a market, or you're in a place that just has a high density population, what can you do? So in engaging your communities and clients, always put yourself in their shoes. Go back to the empathy, go back to think, okay, what speaks to them? What's important to them? And I need to adapt my strategy to meet those people where they are. And this kind of engagement and this kind of authenticity on your part makes a huge difference in terms of how people respond to you, both professionally and personally in your daily life and work life. So an example of this that I think was clever is in France. I live in Paris. So in France, they had posted this sign up about how far you needed to be apart from each other in different parts of France, using the foods of that particular region to demonstrate distance. So, for example, in one area, it was going to be 9 mushrooms and 1 bull. So you can see that this is, for French people, everyone embraced this because everyone looked immediately for their region and said, there's my three goat heads is the distance that I can have. And there were some other clever ones that people were doing, but this is sort of goes back to the idea of sharing these messages about prevention measures in a way that's easy and relatable and accessible. They don't have to be this miserable, onerous, taxing thing. We can make them, we can do what we can to invigorate ourselves in terms of keeping up these prevention practices, because they're not going away anytime soon. So in your business, I encourage you to do fun things to encourage your employees, guests, clients to be able to participate in this, to be able to see a social distancing and giggle at it, to understand where, what is the measurement? I 16 oyster differences. And I went straight to that one. So anyway, share these messages with people in a way that people can relate to and that are accessible. So a standard poster that just said, maintain physical distancing isn't going to be as engaging as something like this. So anyone's producing materials for your company or business, keep these things in mind. Things don't have to be boring to be serious. Things don't have to be dull, don't have to be highly technical to be effective and engaging and ultimately worthwhile. So finally, the best practices for risk communication. When you do these things, when you create and maintain trust, how are people responding to what you're saying? You care about me. I can trust you because you care about me. You're not concealing information from me. When you're open and transparent, if you don't know something, you say, I don't know. You don't make it up. You coordinate your communication with colleagues, with public health experts. And also, don't be afraid to update the information. Don't be afraid to say, we have this new information. We're changing our strategy. We're changing our guidelines. We're going to be asking you to, take some additional steps, or we're going to be separating tables at our restaurants. And also, again, that you're seeking solutions, that you're actively involved in what's going on in terms of how to make your place safer, how to make your clients and guests safe and confident and comfortable. And finally, again, including messages of self-efficacy. This is not only about the self-efficacy of doing something in the context of maintaining prevention measures, but also just saying, there are things I can do to help myself be safe. There are things that I can do to help myself be safe, on top of looking at my vendor and knowing that my vendor is caring about me, addressing my concerns, and is a reliable source of trust for me. So these are super important for our day-to-day communication, but for risk communication in the client relationship is, I think, especially key, particularly in this day and age. So I would say here, finally, this is wrapping it up, don't let your guard down. Don't think that we are already, we're past the worst of COVID. We certainly, those of us who are from countries that have a lot of people vaccinated and a lot of access to vaccine, we are indeed blessed. because not everyone has that same luxury. But every single country, every single person is as important as any of the other ones. So have been pleased to see governments take a more active role, wealthier governments take a more active role in supporting lower and middle income countries and getting access to vaccines, and actually moving forward in terms of ensuring that vaccines are equitably distributed. Don't feel a sense of security just because you're vaccinated. And remember that vaccines alone are not enough to bring an end to this pandemic. Every tool needs to be used. The rest of the tools are prevention measures. We don't know, you may hear a question sometime where people say, I don't know if I'm not going to get vaccinated. I don't know if the vaccine is going to work against the variants. Well, it's something to think about, but we know what does work against the variants, and that's a face mask. The other prevention measures, they're working. The vaccine, probably going to work, might look a little different, but we have these tools, we have to use every single one of them. Avoid the politicization of COVID-19 prevention measures and vaccination. I know it's a tough one for many of us in many countries, and it's still important to go back to the science, go back to CDC, go back to WHO, and deliver the facts, and not let the water get muddied by personal opinions or by people who aren't educated. And encourage your clients and guests to follow prevention measures for the safety of everyone, for your safety, for theirs, and also just for the safety of the community and ultimately the global community. Risk communication and communication doesn't take place in a vacuum. But we oftentimes think we've communicated when we actually haven't, because the person on the other end hasn't heard what we've said. They've listened, but maybe they haven't heard. So this is another reason why we repeat these messages and why we have risk communication as a two-way conversation. I'm going to tell you something, and I need you to tell it back to me so that I understand that you understand me, and that I want to understand you, because we can't communicate unless we understand each other. And it seems very simple, but it is the biggest problem, is the illusion that communication has taken place when it actually hasn't. But thank you so much for taking time to join the session today, and for letting me talk to you about risk communication. And I hope that it's been useful, and that you'll be able to apply these things in your work and everyday life. Thank you so much.
Thanks, Suzanne. First and foremost, I just want to say, I think that some of us are glad that you were wrong last November. So thanks for admitting that. Who would have known? I mean, honestly, it's still such a blur last year, but this is such important information, again, not only for the travel industry, but just for everyone's daily lives. We just have about 2 or 3 minutes, and I want to make sure that we wrap up on time, because everyone does have their last round of scheduled appointments. So I do want to ask one question, maybe two, that I have right here. This is from Scott. Does Suzanne have any advice on enforcing health precautions for fully vaccinated travelers who may believe they aren't necessary for them?
Hi, Scott. That's a great question, and I think a lot of that from a business standpoint is going to need to be addressed by a policy that you establish. People have different perspectives from every single country. In France, for example, we're only now welcoming Americans to come into France who are fully vaccinated as of yesterday. So everyone has different rules, but again, it's your policy and your willingness to enforce it. I have a colleague who has a travel business in Morocco, and he's refusing clients who are not vaccinated and who will not wear a mask with him in the car. So this is a policy decision that you have to make on an individual level, but it's an excellent question and not an easy one. Thanks.
Yeah, it is hard, and I just wish that I had a crystal ball. My most common question these days is, what will travel look like in the fall? And I'm like, let me try and shake my magic 8 ball. But yeah, all of these questions are so difficult. But let's ask one more. We just have 60 seconds, Suzanne, so I'll make you do it quickly. Tell us a little bit about your work in the Philippines. I know that video came through, and we would love to know what you're doing.
I was heading up the risk and crisis communications for the WHO country office, which is Philippines is more than 7,000 islands, and one of the most difficult countries to actually do the vaccine deployment. So I had the great honor and privilege of working alongside the Department of Health and the government of the Philippines to help with the initial vaccine rollout through the COVAX facility with WHO.
Wonderful. Well, thanks so much for your hard work. I do have a few more questions, but Suzanne, I think I might fill those to you personally so I can let people get to their appointments.
Please
We're at
do.
the trail end of the trade show, and everyone, please make sure you join us for our closing session at 6 p.m. Eastern. We'll be giving away some fun prizes. So Suzanne, thanks so much for joining us. Really
Thank you.
appreciate your time and joining us from so far away. So thanks everyone. Hope
Thank
you have a
you.
good show.